Good evening, or sorry, good afternoon. Thank you so much for inviting me to speak to the Third International Health Sciences Congress. I would have loved to have been with you in Ankara today, but unfortunately I can't, so I'm recording this ahead of time sitting in my office in Germany. But I want to talk to you today about improving public health through collaboration, how IFAD promotes dietitians across Europe. IFAD is the European Federation of the Associations of Dietitians, IFAD. And we claim to be the voice of European dietitians. Now, how can we justify this claim that we are the voice of European dietitians? Well, we have 32 National Dietetic Association members in 26 countries in Europe, representing around 33,000 dietitians. And you'll see here, Turkey is a very valued member. And for those of you listening to this presentation, if you're not members of the Turkish Dietetic Association, I would encourage you to join as soon as possible so that you can be represented by IFAD too. We also have 38 education associate members, and they're based in 15 different European countries, teaching over 9,000 student dietitians at this moment in time. Again, you can see that in Turkey we have an education associate member. Maybe you should check with your university if they are a member of IFAD already, and if not, maybe you should ask them why not. IFAD member numbers have been growing over the years. IFAD's actually now 40 years old. We celebrated our 40th anniversary this year at the Congress in Rotterdam. But this slide shows you how our membership numbers have been growing since 2004. And up until 2018, we're now on about 33,000 members of our members. So each of our members are actually dietetic associations, but between them, they represent about 33,000 dietitians. And we believe that this is about half of all the dietitians in Europe. We asked our member associations to estimate how many people were working as dietitians in their country who had not joined their association. And we estimate it's about half. So we think, well, we know we represent about half of all the dietitians in Europe. And that actually gives us a very strong voice. When we talk to politicians, they're very impressed to know that we're representing half of the dietitians in Europe. IFAD has a new honorary president this year. Annemieke van Ginkel-Rees has been elected as of 2018, and she will be our president until 2022. Our executive committee is made up of various people from many different European countries. You can see this information on our website if you want to check it. And we have a new honorary fellow this year. For the first time, we have an honorary fellow called, she is Professor Agneta Hernel. She teaches at Umeå University. And part of her honor is that she'll be invited to speak on a topic of her choice to give the honorary fellow address at the next IFAD conference. So congratulations to Agneta. And if anyone would like to consider nominating anyone else for an honorary fellowship for next year, nominations are now open. And again, information on the IFAD website. IFAD also has 3 standing committees: professional practice, research, and education. And these committees are obviously working on these topics. And we have 10 European specialist dietetic networks covering lots of different areas of dietetics. And I'll say more about their work in a moment. But with all these different committees, we have over 200 volunteers working for us. So over 200 people who are working for IFAD, representing IFAD, being our voice. So how do we use this voice? Well, we have a strategic plan at the moment running from 2016 to 2021. And goal A of that strategic plan is to develop strategic partnerships. And the partnership that we really wanted to develop was with the World Health Organization, the European office. And I am delighted to tell you that this year, IFAD has been accredited as a non-state actor to the World Health Organization European region. And this accreditation was awarded to us at the 68th session which happened in Rome in September. Now, what this means is that in future, IFAD will always be invited to attend the meetings of the Regional Committee for Europe, and these meetings are attended by every health minister from all 53 World Health Organization countries. So that means IFAD will be at the same table in the same meeting as all the health ministers, which gives us an opportunity to promote dietetics at the highest political level. So what is it we're going to say to them when we are at that table? Well, we've introduced the European Dietetic Action Plan. This has been running 2015 to 2020. We call it EUDAP. It's been developed to highlight exactly what dietitians are doing all over Europe to meet the World Health Organization Food and Nutrition Action Plan. And to make sure that we get as much recognition for our dietetic action plan as possible, we have registered it as a proactive commitment to the European Platform on Diet, Physical Activity and Health. This platform is a European Commission action which brings together industry and health professionals and organizations advocating for nutritional health in Europe. So by registering EUDAP as a commitment, it means that every year we can report to this group of people as well as to the WHO on the work that dietitians are doing in Europe. The idea of EUDAP is to inspire dietitians in their own countries to show and share what dietitians are doing. So within their own country and then across national boundaries, so that we can see what people are doing in other countries and help to raise standards in our own country. And then by showcasing what's happening in the country and at European level, we can really show how dietitians are making an impact. And we wrote the EUDAP specifically to look like the Food and Nutrition Action Plan, using the same political language that politicians will understand, so that when we report back to the Ministers of Health, we're talking the language that they talk, and they have something in their hands to show exactly what is happening with food and nutrition in their country. So it's all about sharing information. The EUDAP survey for this year had 5 questions on demographics and 7 questions on whatever the activity and initiative was that the dietitians were involved in. We had responses from 17 different countries. Most of the responses came from France, where our delegate very kindly translated it all into French. I think that helped a lot. We didn't have a huge response from Turkey, but there was a response, and I'm hoping that next year there'll be a lot more. However, we were told about 125 different actions being undertaken by dietitians in Europe this year. Well, actually in 2017, but reported in 2018. That's an increase in the number of reported actions. I'm sure it's only the tip of the iceberg. I'm sure there are many, many more actions that could be reported, but this is a start. It's starting to roll. More and more countries are starting to report what they're doing. And if they give us this information, we can use this to promote dietitians outside of, well, not outside, to politicians across Europe. So, what are some of these actions? I'm only going to give you an example of one action for each of the 5 objectives. Objective 1 of EUDAP is to ensure that healthy food and nutrition is accessible, affordable, attractive, and sustainable. Do you know of anything that's happening in Turkey that would actually show that dietitians are contributing to making healthy food accessible, affordable, attractive, and sustainable? If you do, we want to know. In Hungary, they've launched a project, the GYERE project, which is Combating Childhood Obesity. And that program in 3 years managed to achieve a 7% reduction in the BMI of 3,500 children. This was a project launched by the Hungarian Dietetic Association and worked on by dietitians. Objective 2 is to promote the gains of a healthy diet and nutritional support throughout the life course, especially for the most vulnerable groups in clinical settings and in the community. And in Denmark, dietitians have been working with older adults who have been living in a community dwelling and promoting various activities in relation to meals in a rehabilitation program. Do you know of any projects like this in Turkey? Are people working in homes for older people to help to rehabilitate them using cooking and food and meals? I'm pretty sure you do. And so if you do tell us about it. Objective 3 of UDAP is that dietitians become educators, that we work in the community and in clinical settings to advise the general population, other health professionals, authorities such as ministries, health insurance companies, the media and industry. And in Belgium, they have a cross-sectional approach to the training and coaching of the people who are looking after the nutrition of elderly people. And in this project, they've developed a handbook and e-learning units specifically for the catering staff who are working in the food industry and in the healthcare of the elderly. Objective 4 is to invest in establishing the effectiveness of dietitians in the delivery of better health through improved nutrition. And in Luxembourg, the dietitians are leading a project called the Maison de Diabète, the House of Diabetes, which is an education and information center for people with diabetes. Are dietitians in Turkey working with people with diabetes? I'm sure they are. We need to know about it. And objective 5, to strengthen governance, alliances and networks for a health in all policies approach. And in Spain, the dietitians are really quite politically active. They're working together with their parliament for an independent citizens initiative that aims to make science and scientific knowledge more important in the formulation of policy making. I'm not sure what dietitians in Turkey are doing to influence policy, but if you know of something, again, please let us know. So, the European Dietetic Action Plan Executive Summary Report has just been published this week, actually. It seems strange to publish it in November 2018, but it's based, the 2017 report, but it's based on the data that was collected in 2017. So do look out for that report, and next year make sure that the projects you know about are included in it. Now, I said that IFAD has 3 standing committees, and I want to tell you a little bit about the work that they're all doing. The Education and Lifelong Learning Committee has just had revised academic standards adopted by the General Meeting of IFAD. We've always had academic standards, but they were already 10 years old, so they've been revised. If you're working in education, I would strongly suggest that you read the revised academic standards to see what IFAD is calling for dietitians, or how IFAD is calling for dietitians to be educated across Europe. They're also working on practice placement standards and pedagogic standards for practice placement trainers. So again, those standards are not quite ready yet, but we have the old standards, but the revised ones will be coming out in 2019. They're also looking at the possibility of voluntary registration of specialist dietitians, so people working in food service, for example, who can be registered dietitians, but they can't be registered as specialist dietitians. And we're looking to see if IFAD can start a register. And they've been organising webinars. The Professional Practice Committee have a roadmap on how associations can try to introduce registration of dietitians in their country. In some countries, dietitians are still not registered to practice. So in those situations, we would hope that the National Dietetic Association could start to do something about that. They've done webinars. I did that a little bit quickly, actually, but the webinar has been on electronic health records. And of course, to have an electronic health record, you need to have a standardized language that everyone all across Europe can understand, because patient records need to be able to cross borders. They need to be readable all over Europe. So there's a lot of work going on in introducing a standardized language that everyone involved in healthcare actually can understand, not just dietitians. So that work is going ahead. And they have revised their mission and vision. And they've also looked at the ethics of nutrigenomics. That's a very interesting paper as well, and very important now that nutrigenomics is becoming ever more important. The Research and Evidence-Based Practice Committee are looking, well, they've been doing webinars. They've done 2 webinars this year on evidence-based practice. That's meaning that in the long run, everything that dietitians say, they know for a fact is true and based on evidence. And that's quite a tall ask, really, to make sure that all of us know all of the evidence behind everything that we're saying. So the Research and Evidence-Based Practice Committee is working on that. They've also done a workshop called Make Your Work Count, which is tips on adding to the evidence base. This is encouraging dietitians to just, whenever they're collecting data, whenever they're looking in small research projects or large research projects, that they make sure that they're collecting evidence in such a way that they can share it and that that can add to the evidence base so that we all know that we're actually an evidence-based profession. They've been helping with the UDAP data collection and presentation, and they're doing a survey on the workplaces of dietitians in Europe so we can get an idea of all the different places that dietitians are working, because not everyone is working in a hospital. There are many other places that dietitians can work. And they're exploring the viability of an EFAD journal, and I'm pleased to say actually this work is moving on quite rapidly, and there will be fairly soon a journal for European dietetics led by EFAD. So the European Specialist Dietetic Networks, we have quite a lot of them, as I said already, and each of them has been busily working last year too. In obesity, they have a platform commitment together with EASO, the European Association for the Study of Obesity, and they're developing guidelines on the dietary management of obese adults. They're also developing dietary guidelines on obese children. They've written a paper which has been submitted for publication to Obesity Facts. They had presentations at ECO 2018 and at the EASO Obesity and Hypertension conference. The older adults have been writing briefing and position papers, which have been or will be submitted to a peer-reviewed journal. They're surveying dietitians working in geriatric nutrition. If they represented EFAD in the Manuel project, sorry, I went a little quickly there. The ESDN Diabetes have been supporting World Diabetes Day, including a scientific review of infographics and videos for the International Sweeteners Association. They've been collaborating with the International Diabetes Federation. They've been drawing up draft guidelines for type 1 diabetes. The ESDN Public Health have a fact sheet on food literacy has been published. A fact sheet on fiscal measures has been updated. This is to do with recommendations for taxation of foods high in fat or foods high in sugar, or just using tax to affect how people purchase food. They've worked on a position paper on an evolved nutritional labeling scheme, and they've been talking to the European Commission about front of pack labeling and the recommendations that we as dietitians feel are appropriate for what should appear on the front of the package when people are shopping. They've made recommendations to the World Health Organization on a consultation on non-communicable disease. They have come up with a policy paper on nutrient profiling. They've done a webinar on competencies of public health dietitians. They're part of the Euthyroid project. They've described advanced competencies for public health dietitians. And they've been working with the Food and Agriculture Organization. So our ESDN Public Health have been very, very active in being the voice of dietitians in Europe. The ESDN Oncology have a mission and vision statement published and a briefing paper on oncology and nutrition. They've been surveying specialist groups, and they were asked to provide a scientific review for a paper that has been published in the European Journal of Surgical Oncology, which I think is fantastic. The ESDNs for gastroenterology and the one for sport and physical activity are both quite new, so they have been preparing their mission and vision statements, and they're preparing role statements, but that's about as far as they've got so far. Then we have our EN Diets, the European Network of Dietetic Students. In It's called a European network, but you'll notice that actually they have members in 51 different countries. The students are not restricting themselves to Europe. They are looking all over the world. They have 1,600 students, are members of EN Diet. They last year, or within the last year, have produced 14 webinars, 12 monthly bulletins. They've got daily posts on Facebook, 49 videos on YouTube. They have a lot of followers on Twitter, that's growing, and their Facebook presence is growing as well. They had a Student of the Year award, which it was really unfortunate that no one actually applied for it in 2018. We'll run it again next year. If you're a student or you know a student, please apply. Maybe no one applied because they assumed hundreds of other people would, but actually nobody did. So this is an award that we're dying to give to some student. We just need some applications. So please have a think about who could be nominated for the Student of the Year award. EN Diets also promote themselves at conferences and at universities. They also promote IFAD while they've been invited to do that. And they organize Students' Days the day before the IFAD conference. And these are all always very popular. I think there was over 100 students there this year looking at topics especially important to students the day before everyone then meets to go to the actual conference. And they also produced a fabulous promotional video for the conference this year and last year. So EN Diets are very active, and if you're a dietetic student, I would strongly encourage you to join EN Diets and keep up to date with what's going on in that network. Now, IFAD also has lots of collaborations. I've mentioned World Health Organization, I've mentioned the platform. Obviously, we have links to the International Congress of Dietetic Associations, to the European Nutrition for Health Alliance, who are running the Optimal Nutritional Care for All program, which we're deeply involved in. Our representative to EFSA, to the European Food Safety Authority, is actually a Turkish lady. It's Professor Gulden Pekan, who represents IFAD and has done for several years now and is doing a fantastic job. We work with the International Diabetes Federation, we work with the European Patients Forum, the European Forum for Primary Care, EASO I mentioned earlier, and FENS, the Federation of European Nutrition Societies, who are putting together food-based dietary guidelines, and IFAD is working together with them too. Excuse me. For communication, to make sure that we get our voice out there, we use newsletters, news flashes, Twitter, Facebook group and page, LinkedIn, and webinars. And we've recently entered into a contract with the British Dietetic Association, and they're managing communications for us. So look forward to seeing new style newsletters and news flashes very soon. We have our website, very easy to remember, www.ifad.org. Couldn't be simpler. I don't think you even need to write that down. But do please visit the website and get more information about a lot of the things I'm talking about now. Some excellent videos here if you want to learn about counseling to bring about behavior change, the run-up or follow-up of our conference, and more about UDAP. Lots to see on the IFAD website. So, we know how we can claim to be the voice of European dietitians, and we know how we use that voice. But how do we know it's being heard? Well, there's been a huge increase in invitations. So we've had a lot more invitations to collaborate on projects, to participate in consultations, and to attend conferences, meetings, and workshops. So far in 2018, we've been invited to attend 72 different events. We accepted invitations to 38 of them, and in total we've asked 13 different people to represent us. This is a large increase in the number of invitations that are coming in. Unfortunately, we can't accept them all, but I think it's excellent that so many people are actually asking us to represent dietitians. We have ever more collaborations that we enter into. I've mentioned UDAP already. I haven't mentioned really yet the Hydration for Health, which is a project that we're running together with Danone to make people aware of healthy hydration. We've been working on World Diabetes Day with the International Sweetness Association, on the obesity guidelines with EASO. We've just finished a little project about the effects of snacking on dried fruit on dental health. We are deeply involved in a project called Promise, and we work together with UFIC at the moment on a project which is going to run on Instagram, offering healthy lifestyle advice, including dietary advice, which IFAD will be providing. So, long list of all the different things here. I've mentioned all the first ones, the platforms I've mentioned. Impact and Manuel I've left on here. Impact was a very good project. These two are both finished, but Impact was a project on improving education competences in dietetics that ended this year. And Manuel was about malnutrition in the elderly. That also ended this year, but IFAD was deeply involved in both. For 2018-19, what we want to do with our projects and collaboration is to continue to proactively seek collaborations and income generating opportunities, to increase the UDAP participation, to improve our communication, to promote IFAD, and to increase publications. We have our conferences every year too. We had just had the 11th conference in Rotterdam. We had 445 delegates, so it was the largest conference yet. 140 of those were students. And this year we had 22 sponsors, which was the largest number ever, which says to me that more people want to support us by meeting dietitians at our conferences, which is excellent. Our next conference is going to be in Berlin, which is not so difficult for people to get to from Turkey. And the conference hotel will be directly beside the airport, so it should prove to be a very easy congress for you to get to. Hopefully a very enjoyable congress, bigger than last year. So please save the date, 1st and 2nd of November 2019 in Berlin. And thank you. Thank you so much for giving us the voice to express ourselves. Thank you for listening to me. And if you want to contact me, I'm Judith Liddle, Executive Director of IFAD. You can contact me on that email address. Thank you so much, and do enjoy the rest of your Congress.